So vessels go from proximal, closer to the heart, and move distal. So can you explain to the viewers, why is it that the proximal pole has less blood supply than the distal? Because normally we would think blood supply goes in this direction from the body out, but it's the anatomy, right?
It's the anatomy.
The anatomy of how the blood supply comes in.
Yeah, it's like a retrograde flow.
Right.
Essentially, is what's happening. And again, there's a main nutrient supply
that comes from the distal and then migrates proximally.
Migrates proximally.
So if you have a break, the classic break, and it's displaced even a little bit, like, I mean, with the scaphoid, even a millimeter is bad, right?
Here's the thing.
Yeah.
If it's more than a millimeter displaced, automatically you need surgery, right? So one of the things that that typically is, if I see a scaphoid fracture on an X-ray, I usually get a CT scan to determine how displaced it is. Because if there's any bit of displacement on the X-ray, for sure it's more than a millimeter displaced. I shouldn't say for sure, but a lot of the times we do see that.
Because an X-ray is two-dimensional, right? You see it in AP, and then you've got a lateral, and you can even have special scaphoid views, but again, they're two-dimensionals, whereas the CT is a three-dimensional reconstruction. You can even see the shape of the bone.
Again, and it gives us more
information.
More accuracy of measurement, right? Again, a millimeter is not much, right? So you want to make sure that your measurements are accurate if you're going to take somebody to surgery.
Right.
And so out of those different types of fracture patterns, waist fractures are still the most common fracture, where it's essentially in the middle of the bone, right? For an athlete, the likelihood is you'll fix any type of scaphoid fracture, right? To make sure that they get out onto the field and are able to recover from that. But a lot of the time, even if we fix it surgically, it's a longer recovery, just again because of that blood supply. Right? So usually the length of time you stay immobilized is going to be a few weeks longer than for some of the other typical
risk fractures
that we see.
Right.